Hey guys, welcome to tonight's live. I'm Dr. Tammy. I'm so glad you're here. I'm in a little bit more calmer environment tonight. I'm experimenting a little bit too. I have my microphone on. Honey Bunny, if you can tell me, can you hear me okay? Does that sound all right? There's Amy Cole. Hello, Amy Cole. Lots of folks coming on. I love it. So, hello. Can you guys hear me okay? Put in the chat where you're from. If you're from local, I'm a little out of my element tonight. I am actually in Bryant, Arkansas, and I'm at my fiance's place. So I am a little out of sort. So I do have a board here tonight and I can draw, but I don't have my easel. So if you guys have questions, and I am Bryant, Arkansas, I know where you're from. Yeah, so I do have my little board here and I can draw some pictures, but I'm really here just to have some Q&A tonight. Anything about hormones, no subject off topic, just anything you guys want to know. I have been doing hormones for almost 25 years, so I see it all. And I was in my office today and just had a couple of patients. So nothing too exciting. We do functional medicine in our office. So Fridays are usually a little bit what I call administrative days, so I don't see many patients. So I really don't even have any crazy hormone stories to tell you from today. But if you guys have any questions, anything from menopause to estrogen dominance, water pellets, I get all sorts of questions all the time. So I'm just kind of waiting a few more minutes to see if you guys have questions. I always have stuff I can talk about. So I will go to the board here in just a minute if you don't. I see Tracy there. I see all sorts of new people coming on. That's awesome. So, yeah. Just give you all a few more minutes. Hey! Hey, guys. I was almost a few minutes late. I was like writing on the board and I was like, oh my gosh, it's 7 o'clock. Can you guys hear me okay? I have a new little microphone on, so I'm just kind of testing it. Can you tell me if you can hear me? Awesome. And there's Bridget. Hello. Okay, guys, so I'm just going to jump into what is menopause, because that is usually the first thing. Okay, great. That is usually the first thing that people kind of question, because doctors really don't get that much about menopause in med school or in residency. It's pretty much pharmacology and it's all synthetic that they want to push on us. And most of the time, when you're dealing with a pill for an ill kind of situation that is in what I call commercial medicine, and I am a medical doctor, but I got out of that sandbox a long time ago. I just couldn't play in the insurance sandbox. I could not play the way they wanted me. I've worked for multiple different hospital systems, just could not do it, because I always say, if you listen to a patient, they will tell you what's wrong. And the thing is you have to have time to listen. And if you just give them 5 minutes, I mean, that's my rule, is when I sit down with a patient, I just keep my mouth shut, little niceties like, hey, how are you? Where are you from? That kind of thing. And then immediately when they go into that space of telling me all their symptoms, and menopause has over 100 different symptoms, which is funny because when people do hormone testing with us, there's a little sheet in here and you can fill this out, and there's like 30 different things on here. And a lot of those things women don't realize that that's menopause symptoms and that's hormone depletion. And so a lot of times, if I just listen to a patient when they come sit with me, they will tell me everything. And sometimes I feel bad because I'm like, they all sound the same. And I don't mean that negative at all, because I am a menopausal woman. And I know it's devastating to them because they have so many things on the list that they're checking off. And it almost seems unreal to them that they can have so many things on the list. And sometimes they don't even think that it's a problem until they actually start writing their symptoms down when they do intake paperwork with us. And so when you start thinking about all the things that hormone depletion causes, it's what they call the aging process. But aging is just hormone decline because our ovaries literally die when we go through menopause. And so when you think about what that looks like from the age of about 50 on, not having ovaries anymore, having zero ovarian hormones, and thinking that we have to live like that the rest of our life just because our ovaries dry up or if they get removed, then that is everything that you want to call aging. If you go into a nursing home and you smell the smell because incontinence is because the urinary tract area, vaginal vault, all that dries up, so they're going to have, that urine smell in there. Then they're breaking bones. And so now they're just scooting around in wheelchairs and they're wrinkled and they have dementia and they have all the things that are from ovarian failure, which is what happens after menopause. So all the things that you see in the nursing home is a result of us not having any hormones. And so when we talk about what is menopause, the definition of menopause is just 1 year without periods. That's it. That doesn't matter at all. I mean, it's cool because you don't have to have periods anymore, but just a year without periods means nothing. It's the consequences of not having ovaries anymore. That's the problem. Hi, Elaine. Hi, Constantina. Oh, my gang is coming in. Yay. I'm just kind of rambling right now. So I'm glad to see you here. Hi, Elaine. Hey, Elaine, Constantina, you guys put some questions in the chat because I'm just doing Q&A tonight. I'm not home right now. So I'm kind of out of sorts. My board is a little bit, it's propped up on a zebra chair. So is it a zebra? Yeah, I think it's a zebra chair. And so I don't really have a whole lot going on. So you guys can just ask me things and I will answer things. But so people usually kind of start with, okay, thank you, Carol. Best places to apply BHRT cream. Okay, so when you get your cream and you join into our program, appropriate personal questions. Sure, anything you want, but just don't reveal any private medical information that you don't want the whole world to know because this is TikTok, right? So bioidentical hormone creams, we put them usually on the inner arms. And the biggest thing with the creams is that you don't want to get them on anybody else because they are absorbed through the skin. And so if you want to prevent anyone from getting it on them, then you're going to put like on your inner arms. Let's see, it's kind of weird backwards. Inner arms, inner thighs. I'm kind of lazy, so I usually just do my inner arm. And, it's interesting because if you are worried about getting it on a male, our hormones are such a drop in the bucket that we can hardly affect a male. A male's testosterone is 200 to 1,000. If we get a little bit of our DHEA or testosterone on them, it's like a drop in the bucket. Now, we do have more testosterone than estrogen, apples to apples. But if a guy is on testosterone cream, I won't do that if they aren't really, really careful with their significant other or if they have small children in the house or even pets, really. I mean, because it does get absorbed through the cream. So if you get it on somebody else, and I've had females who have had their testosterone levels go up to the range of a male because there was, their husband or whatever was using testosterone cream. But the other's not so important. And if you put the cream on after bed, that's, or not after bed, after you get ready for bed, after your night routine. And you should also be careful about putting other lotions on first, just for the absorption, so that it's not having to go through another product so that it gets right into the skin. So I know sometimes that's the first thing I do is put lotion on. So you want to make sure that you put it where it's going to get absorbed. It's not going to have to compete with your Jergens lotion or whatever you use. So, but yeah, some people even say you can put it on, the palms of the hands and it gets absorbed there too. I have zero progesterone. Okay, Queen Sandra, come see us. We will help you. So, Sandra, so one of the things you can do is we are running a special this month. It's our St. Patrick's Day special. It's funny because my birthday is on St. Patrick's Day. So I love the month of March. Everything, I try to wear green like every single day. But yeah, bioidentical and synthetic. Yeah, we'll definitely do that. But yeah, if you have zero progesterone, all you do is you go to Hormone Bliss, and that's our website, or you can go to my link in bio and it'll take you right to all this information you can download. And then you order a saliva test kit, and all you do is put your saliva in this tube and then stick it in the kit, free shipping. You fill out this questionnaire, any kind of hormones that you're on, or all the symptoms that you might be having. And it's free shipping to you and free shipping to the lab. And we check your estrogen, progesterone, testosterone levels. And you already know that you have zero progesterone. So we got to get you taken care of and get you on some bioidentical hormone cream. So and he just put in the chat the difference. Oh, Sandra, I'm so sorry. You do not need to be suffering. It just breaks my heart that women suffer. That is my mission. I always say before I leave this planet, and I'm 55, so I don't have a whole lot of time left, is to make sure that 50% or more of women are on some sort of HRT to alleviate their symptoms and their suffering, because it's absolutely criminal and we're being lied to. And it is my mission to undo what has been done. And it's criminal. It's awful. It's absolutely awful. IBS. So yeah, IBS is one of the symptoms that's on our sheet. Any kind of irritable bowel, because estrogen is the main hormone that affects your gut. And so I always think of the intestinal tract all the way from the mouth down to the, exit. That is like, there's like this whole highway. And you know how the little workers would get on the intercom and they'll be like, they're like talking to people on the rest of the road when they're doing construction. And so if you have gastritis or reflux, or you have inflammation in your digestive tract, if your bacteria are off, if your stomach acid is off, if your absorptive cells are off, we call that leaky gut. That's sort of a term that doesn't really get a whole lot of press in commercial medicine, I call it, because nobody wants you to fix your gut, right? Because nobody wants you to get to the root cause, because then you won't need all those drugs after that, right? And the stats are just ridiculous about how many women are on. It's just ridiculous. It's like 40% of women, maybe even higher over the age of 50, are on antidepressants. 60% are on sleeping meds. So it's crazy. And you think about what the agenda is. Well, why would they want to lie to us? Why would they want us to think that hormones are bad? And it's crazy because they put a 9-year-old girl, as young as 9, on birth control and never say hormones cause cancer to them. But then when we have no ovaries anymore and they are all dried up and gone and we have no ovarian hormones anymore, then they say you can't have hormones, they're dangerous, they cause cancer. And doctors are saying that to patients every single day. And it is mind-blowing. I always call it clown world. So I'm sorry, Sandra, that you're having all of that, because getting your hormones balanced will make such a difference if you use bioidentical natural hormones and you can restore those levels and get your life back, because I'm sure it's probably not only IBS, but it's all the things that go with that. Also with IBS, I would say that, I don't know if you're on magnesium, you have to be careful with magnesium. It's so good for the bowels, but it also can cause diarrhea. So you do have to be careful with that. But probiotics, and there's so much that you can do for gut issues. Food sensitivity testing can be really helpful too if you haven't done that. Elaine, if all the levels are in balance in hormone cream, how long will it take to start feeling better? So it just kind of depends. We want to get it right out of the gate. So sometimes we'll try a combo cream just for convenience. And then most of the time, if that doesn't work, we'll go right to individual creams. So we'll use the estrogen, progesterone, DHEA, or testosterone. Pregnant alone, we have lots of different choices. So we want you feeling better within the first few days. To get it completely balanced, it is what I call a balancing act. This is my book, Balancing Act. And so sometimes that takes a little bit of time. And some people are super sensitive to progesterone. So, we have to play with that a little bit. Some people need more progesterone. Some people need less. Some people need more estrogen. We're trying to restore levels to get you where you are at least close to where you were in your 30s or 40s. So why not, right? I mean, if we have no ovaries, it's kind of like not having a thyroid. It's like we would never tell somebody that we're only going to give you the smallest amount of thyroid. No, we would check your levels and we would put you on the right amount that your body needs, right? So it's the same thing when we don't have ovaries anymore. And surgical menopause is when your ovaries are removed, and natural menopause is just when you stop producing eggs and then you stop making ovarian hormones. So either way, we need those hormones, we need those hormone levels, and it is unfair to us to not provide us a way to get those hormones restored. Talking to Dr. Ponder about that, and he said he would talk to my neurologist to see that. What do you feel about taking human growth hormone injections? So human growth hormone is super interesting. It is a good thing. It's sort of it is a fountain of youth hormone. However, it is really hard to regulate in the human body. A child who's growing and needs growth hormone, it is regulated through feedback mechanisms. And sometimes they have to give children growth hormone because they're not making enough and they're not growing, their stature's they're not growing tall enough, fast enough. And so it is super, super, super expensive. I don't know if you've ever known any children that have needed to be on growth hormone because they have a growth hormone deficiency. But like we're talking like I mean, and this could have changed in the last few years, but I remember there was a kid in my peds practice one time, and it was like 10 grand. And this was years ago. So, maybe that's gotten better by now. But so one of the problems with growth hormone is that it can cause you to, like the bodybuilders who were abusing it, they'll get like these big heads and they'll get overgrowth of joints. We call that acromegaly. It can cause heart failure. So we see that a lot with the bodybuilders and stuff who overdo that. And you will shred, you will build huge muscles. That's like the Lou Ferrigno's. But so in microdoses, which is kind of what's sort of gotten out there in Hollywood, and they started using that. But now, and Dee Dee, I'm going to answer your progesterone pregnenolone in just a second. But now we have things that are what are called SERMs, and they're peptides that will actually increase your growth hormone without having to use growth hormone like sermorelin and mapromelin. So it's really much safer to use one of those precursor stimulatory medicines. Because they are medicines, but to use one of those rather than using straight growth hormone. And really, it's almost impossible to get growth hormone now. I mean, they've regulated it so tightly. So yeah, so it's hard to get. And if insurance is going to pay for it, usually you have to prove that they're like checking growth hormone levels, that there is a growth hormone deficiency. So yay, Queen Sandra. Yes, yes, yes. So Sandra too, all you have to do is go to my link in bio and there's tons of information there, and then order a test kit so we can start there and see what else is going on, and then we can get some answers for you and get you some help. And the difference, let me finish this. I was administering human growth hormone for 6 months in my 30s. Yeah. I had quite a few patients, and there was a time, gosh, this was 15 years ago, when it was relatively easy to get growth hormone, but it's become really, really challenging now. And it's up there. It's crazy. Like testosterone is a controlled substance, right? I mean, it's just crazy how they regulate that. And I realize that people can abuse things, but some of this is like really hormones on a controlled on a schedule where it's kind of crazy sometimes. But okay, the difference between pregnenolone and progesterone. So I think I'm gonna have to draw a picture here. I don't know if you can see this. Yeah. Okay, so your body takes cholesterol. I might have to use black because that might be hard to see. I only have black and orange. It's kind of like Halloween colors, isn't it? So your body takes cholesterol, and that's not a fatty globule ready to cause a heart attack. It's actually a steroid hormone, and it turns into pregnenolone. and that turns into progesterone, and then that turns into estrogen, and then that turns into testosterone, and then there's a whole bunch of other hormones in between, and then there's a pathway over here that makes cortisol. So pregnenolone is a fascinating, I know you probably can't see that very well. Let me move this up close. Oh yeah, we can do that. So it's a little tricky here. There we go. So pregnenolone is right here, and it turns into progesterone and turns into estrogen and then testosterone. There's a side pathway over here, cortisol. I'm backwards because I have my things flipped. So pregnenolone is actually a pretty fascinating hormone because it's what we call the precursor hormone to progesterone, but it's pretty amazing. And we do have that. I don't always start our program patients on pregnenolone. Oh, I got it. Yeah, that is why they regulate it for sure. She said bodybuilders use it like a steroid, and yeah, that is why they regulate it. Because they hurt themselves. They'll blow out their livers. It's just crazy. Heart failure. I've seen it in bodybuilders who've come to me to get help with stuff, and it's like they've really hurt themselves. But pregnenolone, yes. Pregnenolone is I use pregnenolone every day. We don't always use that in our program membership patients, but if somebody's really like, I'm good, I could be a little bit better though, then we'll add pregnenolone in because it's kind of the wild card. It can become anything. So I love it. Migraine patients, and would I work with my gynecologist? So our program is all natural bioidentical hormones. They are prescription strength, but because we're grandfathered in, we don't have to go through a doctor. So we would be happy to look at stuff that your doctor has, but because it's bioidentical, it's all natural, it's topical, there's only benefit to it. There's really no risk. Now you can have side effects, which is why our program is built where we can help you monitor and to adjust and get it balanced so that you're getting it right. So you're not just flailing out there, with yam cream or something like that. This isn't yam cream. In fact, I was going to do a video today on yam cream, and I can talk about that if you want me to as well. But okay, so hormones work with people with autoimmune. I do in my practice. So if you want to come to Arkansas and work with me, absolutely I can. I have a functional medicine practice as well as hormones. But we are going to eventually, so the question was, do I work with autoimmune disease, which is just fascinating because at the root of everything, if someone has autoimmune, they have immune dysfunction, and it usually goes back to the gut as well. So we're going to expand eventually, much to the chagrin of my fiance, who is my moderator on here, going, focus, Tammy, just hormones. But yeah, absolutely. And people tell you can't cure autoimmune disease, and you totally can. I mean, you heal the gut, you heal the immune system, supplements, getting your hormones balanced. There's so many aspects to that, but it is absolutely, it's not easy. It's simple. It's not easy though, because it does take a lot of dedication to diet changes and all sorts of things. So autoimmune and migraines, usually with migraines, there's an estrogen dominant situation going on. And Sandra, you mentioned that your progesterone was low. So getting that balanced could make all the difference with migraines. Migraines can be multifactorial, right? So it's not always just about estrogen, but it can also be about, cortisol challenges. It can be stress, food sensitivities, histamine intolerance. So there's lots of things that can cause migraines. Treat low pregnenolone. Don't often check pregnenolone levels. You can, but if they have, symptoms of low pregnenolone, we do have bioidentical natural pregnenolone cream as well. Usually we try to get the major ones, the estrogen and progesterone, but we definitely can do pregnenolone as well. And I think I missed another question a minute ago that went by. Yeah, it's funny because somebody was asking me today about yam cream and is that good enough? And so in the wild yam cream, it's actually a chemical called dysenogen, and it's a precursor. It's a chemical that sort of makes your body make more progesterone, and it's not actually progesterone. So when people say, I'm taking progesterone cream, it can raise your levels of progesterone naturally, but it's not the same thing. So yeah, so you want to use straight progesterone cream. And there are some over-the-counter progesterone creams, but you're only going to get about at the most 25 to 30 milligrams of progesterone. And to restore the levels when you actually had ovaries, usually you need about 100 milligrams. So a lot of times, even if you use like an over-the-counter progesterone cream, it's underdosed for what people need. And then they're like, that didn't do anything. So they're like, that doesn't work. And so a lot of times it's pretty frustrating for people when they're trying to get help and what they're doing is not working, because it is a balancing act. You do have to have a little bit of nerdy science behind backing, how to regulate things with your symptoms and how to know which symptoms are caused by what hormone that's lacking. Did I get all those questions? I think I did. Cohosh. So black cohosh does help. It's an oil base that actually is a kind of, because cholesterol is an oil and it makes your other hormones. So it's an oil base that can actually make some estrogen naturally. And it can help with hot flashes. It's what's called a phytoestrogen. So it acts like estrogen. Consider doing telehealth for functional medicine. We actually do that. The only problem is because I'm in Arkansas, I have to see you in person in Arkansas, or you have to live in Arkansas. I can do telehealth, or you have to come visit me for the first time. And then I can do telehealth across state lines, but I have to see you if you live over state lines. Okay, so Queen Sandra says, I'm taking the pills. I'm assuming that's estrogen pills. I'm in Washington State. Yeah, so if you want to, I don't know what all, we just had some of our tribe. It was so cute. Come visit from, I think it was Minnesota, and they went through, Kansas City, and just came to visit. They just wanted to, see us and meet our team. So it was pretty cute. So yeah, if you do want to come, Sandra, absolutely, we can help you there. So black cohosh is what's called a phytoestrogen, and it can help with low estrogen symptoms, but it's not the same as getting estrogen in bioidenticals or in HRT. Constantina said, what? Constantina, you'll have to finish that. What? Can combo creams work long term, or do they eventually need to be separated? Some people, they work great for in combo, and it's so much more convenient. And I separate mine out because progesterone just doesn't really always like to play in the sandbox with the other hormones. So, and progesterone can kind of pull down, because progesterone has a sedative effect, which is why it's so good for sleep. And it can actually pull estrogen down. So you do have to be a little bit careful about needing more and more estrogen when all you need to do is just separate them out. So very commonly we separate them out. We like to start just because it's so convenient. I missed that. I used to spring out of bed at 4 a.m. Formula. Okay, if you bring that question back around, I just need to send you guys in my blood work so you can know where I'm at on my levels. I sent your paperback that came in saliva kit to my sister. She has a lot of autoimmune problems. Okay. So we really don't work with looking at blood work. We do the saliva testing. If you want to come see me in my practice, then, we can do all sorts of blood work and autoimmune testing. But for the Bliss program, which is my passion project to get as many women on bioidentical hormones as possible, we do the saliva kit. So if you go to Hormone Bliss, which is our website, or my link in bio, you can order a saliva kit. And the reason we like to do saliva kits is because it's convenient. And since, we don't have labs in other places, we can, but we really like to keep it to, it's just simple to just the hormones. But again, functional medicine's a whole nother thing. There's so much testing you can do with all that. But I like the saliva kit because for tissues and tissue levels, it's much better than the blood. Just checks the hormones that are in the bloodstream. So when we use creams, that really helps us with the tissue levels to know what's going on. So that's usually what we do, those together, and get you balanced that way. No, we don't take any insurances. I was just watching a video of a girl. I'm not sure when I repost things where you can see them, but I reposted it today, and she was so cool. And she was saying that basically you have to at some point take your health into your own hands, because insurance is so limiting and they always look for any excuse not to pay. And so it's crazy just how they want you in the system. They want you to stay sick. And unless you're just going to go on their meds, which isn't getting you better, I always say a headache is not an aspirin deficiency. So, it's crazy because the system is only wired to, like, they call it a pill for an ill, right? So you have one symptom and they put you on something for that, and then you have another symptom from a side effect of that, and then they put you on something for that. So it's just so broken. And then especially with autoimmune, and then they want to stick you on all these biologics, and they're terribly expensive. And I have some patients who are spending thousands of dollars a month for things, and it's just crazy that insurance, you think that that's going to cover things, and that it doesn't, and only partially. Rachel said constant migraine with aura daily, 6 months PPD, and it won't stop. Okay. Start an insurance company for non-commercial doctors. I actually thought about that once, Elaine, for like functional medicine and supplements and stuff. Rachel, so go, if you will direct message me, I will tell you something. But there is a supplement. I don't know if you can see me writing here, and it's called, I'm gonna write some of this. I was gonna go through some of this stuff, but it's called ADB5, and it's from a company called Bioidentical. If you want to direct message me, I will send you a link, and they have this app that I have has a like a discount. It's like 10% discount from what you can get online. And Bioidentical is a nutraceutical company, meaning it's not just like what you get at big box stores and stuff. So so this is crazy. I have a very dear friend, one of my closest friends. His mom is 90 years old, and she fell about 3 weeks ago, hit her head, and had a brain bleed. Tremendous migraines. I mean, she couldn't even see. In fact, she was so sedentary because it hurt to move that she got a DVT, a blood clot in her leg, and it went to her lungs. And they wanted to give her blood thinners, but she's got this bruise where she fell, and she's got this brain bleed. And then they wouldn't give her pain meds because they didn't want her too sleepy, because they needed to know, like, keep her alert, because she's got this blood like oozing out in her brain, and any kind of light or anything. So it was like a constant migraine for 3 weeks. Now, why am I telling you that? So my friend is super smart, and he takes a lot of supplements. I think he's 66, 67, something like that. And anyway, he does a ton of research. And so this company Bioidentical, I actually, because I'm a medical provider, and I can send you the link to, so you can have a link, and you don't have to worry about that. But so I have an account with them. So every once in a while he'll be like, I want to try this, I want to do that. And this guy is so smart. Like, he's like an engineer, but like a medical engineer too. Like, he just figures things out. It's crazy. So anyway, he said, will you order me some of that ADB5? I always say ABD like abdomen, but it's ADB5. And so I did. So he gave her the first dose, and she has had excruciating headaches for 3 weeks. Within 2 hours, and she took that, her headache was gone, and her swelling was gone. And because she had a lot of swelling in her legs and stuff, because she was so sedentary, she couldn't move. And so all that's why she got a DVT in her legs. So I think that stuff's like $40. I mean, for that, I would definitely try that if you're having headaches. Now, I know you don't have a brain bleed, but yeah. So when he learns about stuff, it's crazy because he'll tell me and then I'll start doing it, so I'll start recommending that. So sometimes things happen to help other people too. In fact, funny story about him too. He that same company, they have a supplement called Biocardiosine, and he actually cured his diabetes. His blood sugar was running in the like 300s, and I had written a prescription for some metformin or glipizide or something, and it wasn't even controlling it. And then he did the Biocardiosine. He's like, "You're not going to believe this. Like my sugars are controlled." And I'm like, "Yeah, I believe it because you're just that smart. You figure that stuff out." Yeah, Rachel, I'm so sorry. I hate that you're having that pain. I've only had one migraine in my life, and it was just absolutely, it's unbelievable. It's crippling. I don't know how people live like that because it was just, and it was a really weird thing. I feel like it was a God thing because I was supposed to go on a trip and I just felt like I wasn't supposed to go on that trip. And I kept thinking of any excuse not to go on the trip. So maybe I put it on myself. Hey, Paula. So maybe I did it to myself. I don't know. But yeah, so the weather was bad and I'm really scared of bad weather and roads and stuff. And so I was like, okay, we're going to push through this. We're going to go on this trip. And I woke up that morning and it was just like surreal. It was just crippling. And luckily I'm a doctor. So I wrote a script for myself for migraine pills, never taken them in my life. And that was an odd experience because as soon as I got it, it was like I had really bad chest pain. So it's like that was almost worse than the actual medicine for the migraine, but I fell asleep and then the migraine was gone. So I'm glad we do have those medicines, um, but yeah, definitely for somebody who struggles with headaches, I would try that. The other thing is that estrogen dominance, when you have too much estrogen and not enough progesterone to balance it out, because progesterone has a very calming effect on estrogen. If you get too much progesterone, it will pull estrogen down too much and you'll start crying. In fact, I just had a patient that called in today and she's like, I feel so much better, but I'm crying a lot. And I'm like, okay, we got too much progesterone. So you have to balance that out. But hormone imbalance is one of the biggest things that causes migraines. And after menopause, the creepy thing is that your adrenals are still making some of your hormones, a very small amount, but your visceral fat, the belly fat in your center, that we call belly fat, actually converts any male hormone that you have into an estrogen called estrone, which is just a wild card estrogen. God doesn't make a bad hormone. He doesn't make a bad estrogen, but it's an estrogen that is what we call proliferative that can cause overgrowth of cells, of breast cells, of anything. So we don't want a lot of estrone. Estrone can absolutely cause proliferation in the blood vessels in the brain. And so when that happens, it can cause blood vessels basically to swell and cause headaches. So initials stand for, oh, I'm not sure. They name things really weird. I've talked to I like Metagenics. That's another nutraceutical company. And I've talked to them before. What they do is they actually market to doctors, not to the public at large. And so they use almost like pharmaceutical companies. Those big names that pharmaceutical companies have, like that start with an X, Y, Z, Ziframalam or whatever. And so I think they really try to separate, which I hate this. I like totally don't agree with this, but there's almost this separation. If you can speak a different language, you can have control. And I totally believe that patients should have autonomy, that you should understand, that you should know what this is that you're putting in your body, not ADB5, right? And I love this company. They have really good stuff. Don't get me wrong. But like it should just say what it is, right? It's kind of like these big names that they give on all these medications. It really separates patients from their own autonomy and in their medical care. I am so like, I'm so against the system. I'm like, if somebody has a red bump on their skin, in medical notes, in medicine, we're supposed to say that that's an erythematous papule or a maculated, I mean, it's like all these big words. And I'm like, I think it's really important that I say they have a red bump on their skin so that if that patient looks at their own notes, they know what they have. They know what I said. I mean, it just like, why do we have to speak Latin? Why do we have to speak another language? And it's just, why do pharmaceuticals have like 5 different names, right? And so you have to go to med school to know all those things, right? And so then like your autonomy is completely gone. So yeah, I think they do sometimes hide ingredients, but I think mostly it's just to keep the separation. And so I think the nutraceutical companies, because they're more, of an investment, I don't consider it expensive. I say it's an investment because if it's higher quality and it's what it says it is, and they've got research behind it, then it's definitely worth it. But when I looked it up, it's adrenals. So I know that the AD is adrenals, and I'm not sure what the B5 is. And I meant to do that tonight too, because when you told me that, I was like, you've got to be kidding me. This woman has been in excruciating head pain. And she cut her head really bad. I mean, they had to put staples in it and everything. So just the injury alone, I mean, not even the brain bleeding. Oh, okay. Well, there's like this little slidey thing in my fiance's office. I'm not used to this room. Sorry. But yeah, I mean, just even having a big, cut on the back of your head. So I was just pretty blown away. And I think that was yesterday he told me that. And I talked to them just a little bit ago, and she's still pain free. So that's pretty awesome too. But Biotics is a great company. They have a lot of good stuff. There's one that Biotics has called Bioimmunozyme, and it's really good for seasonal allergies and for immune system issues too. So that might be one that you want to look up if you have a lot of colds and allergies. I have a free download on great things to take if you have chronic seasonal allergies, but I don't have it in my link in bio list. So if you want to direct message me, I can get you a link to that. So I'm all about education. Love it. Fertility Bliss. Yes, my fiance is very passionate about the fertility program. I think when I told him that I had written a book and have this fertility program, that we have women that can get pregnant within as soon as 1 month. I mean, it's nuts. And these are women that have failed in vitro and you just like all the drugs, all the things they do to try to help with fertility. So it's pretty crazy, and it's all natural. It's all natural. We combine genetics, nutrition, anti-inflammatory diets, supplements, and natural progesterone. Super easy. And then we cycle the progesterone. So yeah, that's exciting too. Okay. Any other questions? I think I missed some questions a while ago. Sometimes they come too fast and I don't see them all, but what else? So, kind of just what I want to leave you guys with, because I know it's we're running into time here. We can end a little early tonight if you guys don't have questions. It is Friday night. We probably have other things we want to go do. I think this is probably Dateline night. We like to watch Dateline. I don't know if you guys like what you like to do on Friday nights, but Constantina said sleepy in the mornings and now on the creams. Okay, so sleepy in the mornings, we probably have too much progesterone. And I don't know if we've separated out the estrogen from the progesterone yet. If we haven't, we definitely need to. But sleepy in the mornings, we need to back off on the progesterone cream. So if you are using separate, then however many pumps of progesterone cream, usually what we'll do is we'll just have you take one less and test that. So, and then sometimes we have to look at other things, if somebody's sleepy in the morning, could that be some issue with sleep, like sleep apnea or something like that? But usually that means that there's too much progesterone on board. Separate arriving. Oh, goodness. I don't know. Let me have the girls check on that Monday, because we definitely want to get that taken care of. So yeah, if you're using the combo still, I would back off on it a little bit probably, but we'll definitely check on that. Because I don't know, we've had some really bad weather, so I don't know. I wouldn't think that would explain it, but let me check on that, make sure they got that out. And Bree just joined. Hello, Bree. Hello, hello. So, okay, so let me just one last little thing here. I'm just going to kind of share here, and then we'll bounce a little bit early tonight. But I usually have a easel, but I don't. So let me see if I can get this right here. Where are you? Am I wrong direction? Okay. So this is kind of the thing I always want to leave women with is if we drew a graph and we put hormones on this axis and we went from birth to 100, and at 50 is about the age of menopause. Menopause is just a year without periods. And baby girls are born with all the eggs they're ever going to have in their ovaries when they're born. It's a basket. So it's kind of like a basket with eggs in it. And about the age of 30, we're down to about half our eggs. And by the age of 50, the eggs are gone. Sometimes it's 52 or, I've had some women go to 54, but the eggs are gone. And so are our ovarian hormones. They are completely tanked. This is the hormones throughout our life. This is our fertile years. This is perimenopause, which can happen anywhere from 30 to 50. And the hormones get really erratic and then they completely drop off. So we want to be able to address what we call ovarian failure, not menopause. That's just a year without periods. That doesn't mean anything. But what happens here is we start to get broken bones. We start to get heart disease. Heart disease is the #1 killer of women over 50. We start to get wrinkles, skin changes. We start to get headaches, or they get worse from, when we had hormone balances before. We start to get mood changes, brain fog. I mean, all the things, brain fog, not sleeping, or tired or exhausted. And so all these things happen because we don't have these youthful hormones anymore. So living from 50 to 100 is absolutely cruel. And I always say if guys had to live like that, like flatlined with no hormones until they're 100, that would be awful. It's fun being a woman. I like to be a man in my next life. I don't know that they have it that much easier. I have a male patient that I saw yesterday, and he actually drove like 4 hours from my hometown. It's great because I just, community and love and just loving patients and taking care of them, that goes a long way. So anyway, he'd heard that, we do functional medicine. So anyway, his testosterone, he's in his 20s, late 20s, and his testosterone was just in the toilet. So it's crazy because they have issues too. And their testosterone drops at about 1% a year after the age of 30. So they never flatline like we do, but they do decrease. And so, better living through chemistry. I think it's not fair for men over the age of 50 to have to suffer with almost bottomed out testosterone levels. It's cruel. And for women not to be offered DHEA or testosterone, because we actually have apples to apples. We have more testosterone than estrogen. Now, men have a lot more testosterone, but for us to not be offered, what we think of as the male hormones is just cruel too, because we need that for muscle mass. We need that for skin. We need it for bones. We need it for brain. So there's so many things that go with that. But anyway, long story to say that guys don't have it all that much easier too, but women are more complicated. I always say that men are like a light switch. Women are like the cockpit of an airplane with all the switches, because we have to have babies. We have to have menstrual cycles. We're just super complicated when it comes to our hormones, and getting it right, getting it balanced is absolutely pretty tricky. And especially in the environment. I just did a video yesterday. So if you go back to my bio page with all my videos, just did one yesterday that I think had everybody super freaked out because it was all the chemicals in our environment. And the scariest chemicals are what they call the forever chemicals. They're the basically the chemicals that like make McDonald's French fries like 20 years from now. I mean, it's like you would think like, hey, I want some of that because it's going to preserve me forever. But they're horrible. They're what they call endocrine disruptors, and they cause cancer, and they are affecting fertility rates, and they're messing with our hormones in ways that women have never had to deal with before, and men too. Fertility, sperm counts, things like that. So there's some really scary chemicals out there, and I try not to scare people, but I do like to bring information that you need to know and how you can make some changes in your life too. And always all about getting hormone balance. So but anyway, any other questions? I was just kind of looking. So if you would like to get your hormones balanced, that's what we do. And it all starts with ordering a test kit. So this test kit, when you get it, it's free shipping. And we have a great deal going on for the month or until March 17th, till St. Patrick's Day. It's our St. Patrick's Day special. And normally the kits are $129. And it's only $97 now. So get your kit now because it's a great deal. And when you get your kit, it's free shipping. And then once you do your lab test at home, it's free shipping back to the lab. And then we get the results. We'll give you the results, and then we'll make recommendations for bioidentical hormone creams, all natural, no medication. It is just all natural hormones. It is the exact hormones that your body makes, your estrogen, progesterone, testosterone, pregnenolone, whatever it is that we need to help you with. So, and then there's a questionnaire, and there's over, oh gosh, I always say 30 things, but there's like 70 things on this list. Everything from frozen shoulder. I always like, that's crazy. I know people are like, frozen shoulder? Are you serious? Memory problems, vaginal dryness, fibrocystic breast, slow pulse rate, skin thinning, hair loss, urinary incontinence, neuropathy, all sorts of things. So you can go watch some of my other videos too. I talk about these symptoms and why. So estrogen is more of a growth hormone. And so anything that needs rejuvenated, your skin, your bones, anything that has turnover that needs to keep alive, estrogen does that. And progesterone is the balancer of estrogen. And I love the analogy. It's like, think of Goldilocks and the Three Bears. So Mama Bear is estrogen, Papa Bear is testosterone, and Baby Bear is progesterone. So progesterone balances out the estrogen. And when they are all together, it's a happy family. And you don't need as much progesterone as estrogen. So Baby Bear, so you don't need as much, but you do need it to balance out estrogen. Oh, good. Constantina, I love that. She said her osteopenia is reversing already. Yeah, it's really fast, and they want to stick you on all these medicines, and all you need is estrogen. You just need that for your bone turnover and vitamin D too. So I'm so excited. That is awesome. And stop the medicine. Good. Those bone medicines are terrifying to me. Plus, they cause jaw crumbling in rats and osteonecrosis of the jaw. It's pretty scary. When pellets wear off. I'm not sure what the question was. Can you start the hormones when the pellets wear off? Is that Susanna Lee? I'm not sure what the question was. Is it about pellets? So if people aren't familiar with pellets, grabbing an ink pen off the desk here. Pellets are when they take a little thing called a trocar, and I do this in my clinic too, but we make a little incision in the skin, and then we drop the little pellets, and those can be bioidentical testosterone or estrogen. And then they last for about 3 to 6 months. I'm not a fan of doing pellets in women because, like I say, the cockpit of an airplane, we are so complicated, and these pellets last for 3 to 6 months. And so you stick a bunch of testosterone in a female, it's really asking for trouble. I'll only do pellets on a female when we have got everything balanced and stabilized. And then even then, we're still guessing on what their body's going to do with those pellets. But I would never, we have clinics in our town. They just don't even test labs, and they just stick testosterone pellets in women. And I had a lady not too long ago, and she actually begged me, came in as a new patient. The girls that, took the appointment, they had no idea. I mean, she was just hysterical, and they're like, she just wants to talk to you. She just wants to talk to you. And so she's like, can you take these pellets out? Oh my gosh. And like, I don't know this lady, and I'm thinking, is she just crazy? And so, we drew her blood to check her levels, but, I always listen to my patients. And so we took them out. I had to dig them out, just like you put them in, except it's a little trickier to dig them out because they start to dissolve a little bit. But like the next morning she called and she's like, thank you, thank you, thank you. Her testosterone levels were higher than most teenage boys. It was like almost 1,000, and she was just losing it. I mean, it just kind of, if you could just imagine like injecting rage and like Hulk into a body. I mean, it was just, and she was so sweet, and she's like, this is not me. This is not me. I'm going to hurt somebody or myself or something. So, yeah, I mean, not all those are extreme, and a lot of women, love the pellets. So I'm not trying to dog the pellets at all. Okay. So I know we're about out of time. So go to Hormone Bliss and order a test kit. At least just see what your levels are. If you're thinking, could it be my hormones? Like for $97, you can find out. So the saliva tests are a very sophisticated. People are like, is that a legit test? It's a very sophisticated spectrometer that they use, and it's called LCMS. It's very nerdy. It's been researched for probably 30 years. So it's not something new, but it's super convenient so that you can do it at home and you don't need a doctor to order blood tests. So yeah, just go to Bliss, order a kit, and you have to use the code for St. Patrick's Day. I should have mentioned that. It's green 97. And so it's $129, but if you use green 97 at checkout, it's only $97. Normally it's $129, and then with the discount code, it's only $97. So get you a kit and let's see what your levels are, and then we can get you on some bioidentical hormones. And it's not always easy the first time. I always tell people, please just stay the course with us because we will get it figured out. I've never had a patient ever in my whole career that if they stay the course that we didn't get it figured out. Now we do have adjustments, and we change and we gain weight or lose weight, or we have stressors and cortisol spikes in our life, and we, get older. So it's all about the balancing act. But if you're willing to stay the course and it's really important to you, we always get the balance. Susanna, so I am in Arkansas, in Northwest Arkansas, but you don't have to come to see me. You can just go to hormonebliss.com and order a test kit, and we can help you. We have our hormone coaches that are wonderful. And so once we see your labs, we can make recommendations and make adjustments and get it right for you. So yeah, absolutely. Go get you a test kit. And we are, this month, my second edition Balancing Act book is out. And so we've just recently been kind of saying that if you order a test kit now, we're going to stick one of my books in with the test kit when you order it. And it's pretty cool because it's all things hormones, but it's got like check boxes, and it's kind of like a workbook too. So it's super cool. So it kind of makes things a little bit easier to understand. And my mission is to help you guys feel better and that women stop suffering, and that we don't have to live until we're 100 or however long we live. We don't want to live that long if we have to live without hormones. But as long as we live, that we have great balance. I'm 55. I feel great. I don't hurt anywhere. I feel like I'm 30. So I want that for you guys too. And I love you all very much. And thank you for being here with me tonight. I know you could be anywhere else. So for you to hang out to me, it really means a lot. And I don't take that lightly. So I'm going to get off here now and go enjoy the rest of my Friday, and you guys too. And just know that someone out there is rooting for you. And I hope that you root for you too. And please share these videos. And yes, Vivian, you're so welcome. Please share these videos with your friends and tell them that there's this crazy doctor out there who says all these really crazy stuff, and just invite the conversation to open up, because that's how we make a difference. Just one person at a time, right? Hi, Jan. You're so welcome. Okay, I love you guys. Please go have a wonderful evening. And I do these on Monday, Wednesdays, and Fridays at 7. So tell your friends, because I'm here answering questions. And usually I have a bunch of nerdy science. And tonight it was I'm a little out of sorts here, but I'll be back home Monday, and we'll go back to nerdy science again. Okay. Night, guys.